first of all, thank you for taking time out of your practice. Thank you for waiting for us. We are just fixing every little detail. We hope that this webinar will be benefit from you. We will discuss about 3D photo documentation, and we have today a panel of 3 experts all around the globe to discuss this topic. So I would like to take only 5 short minutes, and then the panelists will be able to talk. We will start by presenting who is QuantifiCare and the challenges you may face in your practice. All right, so I will share my screen. So first, QuantifiCare. So who is QuantifiCare? So QuantifiCare has been created as a spin-off of INRIA, the French research institute, which is world-renowned in computer science and automation. We have more than 2,500 scientists in this institute. So QuantifiCare, we take our roots in imaging science. Our vision is to provide proof through imaging, and we have 30 experience in this field. QuantifiCare, we are splitted in 2 business units. So first, we have clinical trial imaging. In fact, QuantifiCare brought standardization by way of digital photography in clinical trial before it became the norm. We were the first company to develop a compact and portable 3-dimensional imaging system for standardized image acquisition. And in COVID time, we challenged our business model, and we released a mobile offer for clinical trial and even incorporating AI into our solution. So then we have a second business unit that better fits to people being here today, which is how we bring this amazing technology in your daily practice. So we built on our clinical experience and expanded our offer to provide a full range of innovative 3D imaging system to dermatologists, plastic surgeons, and aesthetic practitioners. The aim is that inside your practice, you can take all of this device to get before, pre and post-op images, to be able to do simulation on your patient directly, and to get facial skin analysis or body measurement. We have been 3 times awarded as best aesthetic device with 3 of our systems. So what drives us at QuantifiCare? We know the challenges in aesthetic photography, and this is what drives us today. So we know that almost if each of you has been experiencing in your daily practice hard time sometimes when it comes to obtaining an optimal image quality, and we wanted to address that. We know how hard it is to get standardized before and after, which could be reproducible in the long term. And finally, we were thinking about the little plus that we can get, which is about having an effective simulation and quantification to address your patient with more possibility during the consultation. So here is the full range of camera that we get. What is common to all of our camera is the ability to do standardized photo documentation and the fact that they are portable. For that, they use a set of dual beam pointer that enable you to take picture always at the same distance and to have reproducibility in every picture you can take in your practice. Here is the LifeViz Infinity, which is our bestseller. This is an adaptive system for face and body, and you can acquire 360-degree images. This is what you get. You are able to superimpose before and after, and very accurately compare them to see visually the difference, even for very subtle changes. Then this is the result you can have on the face. You can see a comparison before and after. And as we said, if you want to go further, you can even quantify the results and know how many cc has been injected and the increase in terms of volume. So now let's move on to the webinar agenda. So as I say, we are very excited today to have our panelists, which are all around the globe. So let me introduce them. We have Dr. Ligia Colucci, who is a dermatologist in Brazil. We have also Dr. Diaspro, who is now on camera, who is a facial plastic surgeon in Italy, and Dr. Johannes Dayrit, who is a dermatologist in the Philippines. All of us will discuss about challenges facing by physicians in their daily practice, photo documentation and reliability, how the LifeViz can help. They will present briefly their application, and we will keep for the end the question and answer. We received and we can see in direct the question that you are asking in direct in the Q&A box. We will sort them out and reply to all of them at the end of this webinar.
Please, thank you very much, Aurora. Thank you everybody to be here. Thank you very much everybody for the big patience you are showing. So back on the topic, all of us, each one of us can tell definitely that to deal with unrealistic expectation of the patient is something that every day used to challenge our practice. Definitely, the patient used to come to our office having something in their mind, coming from social media or coming from some magazines, advertisement, and whatever. And basically, they are looking to be something similar to some models they can fix in their minds. I've been treating her recently. Definitely, I cannot explain to my patient what it will happen better than this photo can make. Consider that on this photo, which is not just an image, this is like a box, plenty of data that you can take advantage of. Okay, you can go further with the tool of the system we are gonna show you during this webinar, and you can have a measurement, direct measurement of the changes you can see. You can highlight the changes in order to quantify, in order to assess it quantitatively. You can have the volume change that, of course, this face has experienced, and you can, of course, also try to compare, as Aurora showed before with the tool, the half of the face before and after, like a mirroring. This works except in a very, very efficient way for your patient in order to open their mind to the result you can get for them. Again, I cannot find the word to properly show and to properly give a right explication on what you can see in this photo. This is something that has really great. I have been really of great value when I start to choose my 3D system and let the 2D system go, because it is still in my office, but honestly, this is not anymore my standard.
All right, so then another challenges in practice. Here you wanted to speak about the inability to see the changes at start of treatments.
All right, so I agree with all the insights and observations of Dr. Alberto Diaspro. In the Asian population, objectivity and transparency are definitely the more vital elements in a medical consultations. And patients would usually like to see how they look like during baseline and how their skin condition was also at baseline and in each follow-up consults. The patients in this day and age usually expect a more detailed explanation on, for example, a treatment or a rejuvenation plan. And the pictures that are shown on the screen is a case, for example, of a 40-year-old female diagnosed as long-standing acne. However, on 3D medical imaging on the left, we see a decrease in volume of the nose. So this is basically a case of rhinophyma. These are before and after pictures. And the medical imaging device that we have also has a redness detection tool, which shows central facial redness, which normally you don't see on brown skin. So this is actually a case of rosacea. So treatment and prognostication will definitely be different.
As a dermatologist, we always treat patients, facial patients, but my journey with 3D system started with a body system that I bought that is cryolipolysis, cool sculpting, and then I decided to buy it, QuantifiCare system, body and face system, because I wanted to show patient the before and after with more accuracy. And because we know that cool sculpting treatments, cryolipolysis treatments are different from surgery like liposuction, but we can have results and we can understand better the treatment plan, the patient. We can show the patient the treatment plan, goals, and we can define expectations. And with the 3D system, we can show better to the patient the results that we can have with no surgery treatment, like cool sculpting, and then plan another treatments after this one. And with the body QuantifiCare system, we can also measure what the patient lost or gain if it's a collagen treatment. And as you see in these pictures, we can measure the volume of fat that the patient lost and the measure of the waist and the abdomen circumferences.
So another challenge is also to ensure patient satisfaction. How do you feel it is in your daily practice?
I agree that one of the challenges in a medical consultation is patient satisfaction, and an open dialogue or a very good communication between the patient and the doctor is very important. And most of the time, I observe that the patient would actually forget how they looked like at baseline. And same thing with doctors. We usually forget how how the patients looked like during the initial consultation. So it is always very important to refer to a previous photograph with a very good quality that also shows the objective findings. And when I tell my patients that I will take a photo, I usually tell them that I'm going to use a state-of-the-art equipment, which can actually standardize the photos at baseline and in each follow-up. And treatment can also be adjusted based on the most recent photo, and prognostication will also be very important. So in every follow-up, if we see like positive changes, then we can continue or improve on our treatment plan. If we don't see any changes, then probably we can just stop and rethink whether we are dealing with the right diagnosis or if we are dealing with the correct set of treatments.
Yeah, definitely. In my practice, honestly, I was amazed when I I just can catch how the patient really do not keep in their mind the way they look at the first consultation. You know, no matter if you are doing surgery or not surgical treatment, mostly on the face. Honestly, that's my practice, but Dr. Colucci can tell us also about the body. But no matter if you are working surgically or not surgically, the patient immediately used to forget to forgive the way to forget the way they look in before the consultation, after you made the first treatment. This is something that with the 3D you can highlight in a very efficient way, because honestly, most of the time I'm taking photo with 2D system, with normal cameras. Honestly, I found myself complaining about the fact that that photo cannot be shown because of the different light, of the different situation in which one, the different position in which one I took that. And so basically I miss that. And the patient, of course, is just keeping its opinion, her or his opinion. With the 3D, I can really feel that I have in my hand a reliability of imaging that allow me to open, no matter which one of the photo I've been taking along the patient history, maybe just one or two, or maybe a lot, but in any pages of this long book, I can every time fix in patient memory what he or she used to look before. And this is, for me, very, very important, no matter if for surgery or non-surgical topic, honestly.
Perfect.
And as Dr. Alberto and Dr. Dayrit said, the patient always imagine them better than the photos. And when they see the photos, they realize what we can do for them.
Exactly. So how to improve clinical practice? I will just move on a little bit because we are behind schedule. So I will let Dr. Dayrit speak, but the idea is really to make your life easier. So you as doctor, you are not a photographer. So with 3D, we can help. And Dr. Dayrit will explain how it has improved his clinical practice.
Yeah, photo documentation has always been a part of my dermatology consultation. And I'm amazed how it evolved from the early 2000s when I was still a dermatology resident. And at the time, I was using the SLRs and the DSLR until I used the Micro Four Thirds camera with a proper setup. But it was 2 years ago when my photo documentation has revolutionized with QuantifiCare. And the most important element in my medical photography is standardization, and it has developed very well, or it has really revolutionized because there is usually the same perspective, there's usually the same contrast, brightness, color, and a standardized background. So for example, in this upper left photo, we see very significant improvement in melasma after a combination of a new topical treatment and after 3 monthly sessions of the 577 nanometer yellow laser. The left lower photo shows a case of rosacea fulminans, and there's definitely the patient after 6 weeks of oral isotretinoin and azithromycin 3 times a week has definitely improved. And in general dermatology now, the applications of the 3D imaging system with its tools to detect like pigmentation or redness. Now I'm using it also to differentiate between the hypo with the disorders of hypopigmentation. So for example, in vitiligo, where you see like white areas with follicular hyperpigmentation versus other conditions such as pityriasis alba. So I have used QuantifiCare on almost all my patients presenting with lesions on the face.
All right. So photo documentation and reliability in your daily practice, one of the first aim could be to provide assurance. So Dr. Colucci, if you can explain this case.
Yeah, we can show patients not just the skin conditions, but beneath the skin. So the vases, the spots that they have, and we can program a better treatment for them.
Also, we can, so with a good photo documentation, we can help to compare before and after.
Yeah.
Yes, this is a case of nose reshaping. As you can appreciate with this tool, which is the mask, I mean, you can overimpose the two images. Actually, this is a pre and post-op photos, in which one you can appreciate on the clay the pre-operative situation of the nose, as you can appreciate. And on the mask, the superimposed mask, you can see the nose as it is afterwards. So this is a nice way, of course, just to deal with your patient. But if we go further, we can appreciate also the fact that on the other slide, please, Aurora, we have also the chance to simply show to the patient what has been changed in her face in this case. Okay, this is something that of course can be done by 2D photo, of course, I have to admit, definitely. But the fact is that, and you can appreciate it, these two pics, they are not exactly the same, but the software will provide for you the exact position, and the reliability of the position of the two images will be guaranteed by the software. So we are not taking the same photo every time, but through a computerized, let's say, alignment, we can be sure that the images we are having on our screen, they are put exactly in the same position, one considered to the other. So this is something that cannot be dealt without a system. You cannot make a manual alignment of your photos. You can do it on X-rays, but definitely cannot of such a good quality of the imaging.
All right. I will just move directly to the benefits because I'm seeing the time and I would like to keep some time for the Q&A. We wanted to explain really the benefits of 3D. So here is a quick image that shows the difference of movement and dimension and the impact of 3 dimension. And now let's move directly to how the LifeViz can benefit you in your practice. We have 3 main aspects we wanted to discuss: the fact that to open discussion, sell more treatments, and multiple use in consultation and treatments. So first, to open discussion.
So for me, definitely, as I've been the chance to express before, this 3D system allow me to open a communication channel with my patient, which is dedicated to something which is objective and not reliable and not subjective at all. What I mean is that when I'm using my 3D system, I can be sure that the patient will be able to appreciate, and I will be able to fulfill any detail, any query of the patient will be fulfilled by all the data. I can, let's say, explode from the imaging I have on the screen. This is for me, except that for scientific reasons, but this is for me the best and the strongest point of the strongest advantage. That's why to choose a 3D system for your practice.
For me, I raised the bar of my consultations. I can assess better, and I also have my staff trained to use the QuantifiCare system.
Yeah, this is something impressive. You mentioned, Dr. Colucci, the fact that you
Yeah.
raise the number of conversions thanks to the picture.
When the patient get to my practice to be available, even for the body consultation that is only with my physiotherapists, they take the picture, and when they see the picture at the computer, they always ask it about it. Oh, is that really me on the computer? I am so different was I use it to see in all my mirrors.
Nice example. And finally, Dr. Dayrit, do you want to comment?
Well, I just want to reiterate that definitely this 3D imaging system or equipment has revolutionized my practice, not only in general dermatology, but also in the aesthetic field. And I would like to highlight that the equipment is very easy to use, and we don't need a special room. We don't need a complicated setup. It takes about 5 minutes to take the three-dimensional photo and 5 minutes of processing. And after 10 minutes, you can show the patient how they actually look like, how their skin condition looks like. And in each follow-up, you do the same thing and compare baseline and more recent photos, and then you discuss your treatment plans with your patient. So this is definitely, I think, in the near future, I I would highly recommend the equipment to all like dermatologists as well as those who practice in the aesthetic field, like cosmetic surgeons and plastic surgeons.
So thanks to all of you. This is a perfect transition to the question and answer. We got the question about how easy is it to use. You just reply to it. So this is a nice one. Then, if you still have 1 minute, I just want to reassure everyone. We will answer to all the questions. If there is some pending question, we can answer them after this meeting, of course. And now, so do not hesitate to use the chat. I'm seeing a question about how is it something that can be used in your daily practice, like every time? So if someone would like to answer, this is your time.
I use it in all my consultations. I get my staff prepared to use it, the camera. It's easy to do it. I have a lot of friends that have the system, and they themselves take the photos, but I prefer my team to do it, so it's easier. And when I get the patient to my practice, to my office, we see together the photos and plan the treatments, and they get surprised with the photos, and they want to do the treatment. So it's a great investment.
All right, I'm seeing another question. Could you elaborate on golden ratio? So if any one of you is using the golden ratio, I'll let you comment on that.
What is definitely intended for golden ratio? I mean, there is some reference point that we can have, which is anthropometric point. We have this reference. We can adjust the position of, let's say, the head of our patient once the photo have been taken, in order to have a proper position and the anthropometric point. The golden ratio it has to be clarified in order to give a good reply. And I want to fulfill the question, but the answer. But honestly, is something that it could be. It is a bit open as a topic to be discussed. So I like that if the attendees can give us more detail, I will be happy to fulfill any query. Every image could be arranged by anthropometric point and position. And once the anthropometric points are set, of course, you do not have to set all the anthropometric points. You have to set just the canthal point and the nostril point, and then of course the software will rearrange it for you. But once it is done, of course, all the calculation of the facial proportion, facial third, facial sixth, and whatever, they are calculated by the software. So you get it ready to use with your patient.
All right, thank you. I will take just one last. I will just take one last question because we are on time, and then we will close. So the question for Nada is, can it be used to see the improvement of melasma in dermis? Maybe Dr. Dayrit, you want to comment on this one?
Yeah, melasma is usually epidermal in location, and this has been proven by histologic studies. However, in the past, there are certain conditions which we call dermal melasma, when the color already of the pigmentation has become a little bit grayish or bluish gray. Well, definitely there's a difference in the, especially if you use the pigment tool, there is a difference in the distribution of the pigment. There is more, there are more intense darkening or black color with the epidermal type of melasma rather than as compared to the dermal type of melasma. And when we talk about like dermal pigments, sometimes there are a lot of differential diagnoses that we have to consider. And now what I'm doing is that depending on the, using the QuantifiCare imaging device, I usually map out the areas involved in pigmentation and subclassify whether we are dealing with just melasma or ochronosis or iatrogenic forms of pigmentation and the other forms of dermal hyperpigmentation or hypermelanosis. So we can actually tell the difference. We just have to document each and every patient that we see presenting with hyperpigmentation on the face.
All right, thank you. I think it's time to close. I really want to thank you all. So first, the expert being here today. We are very exciting for having this discussion through the practice all around the world, through your different usage. It was very interesting to have dermatology plus plastic surgery at different level discussing all together. I have just learned that Dr. Diaspro, this is your birthday today, so I want to wish you a happy birthday and thank you for being here for your birthday.
Happy birthday!
This is very nice.
Thank you.